you have unexplained infertility and no one's tested you for SIBO, your workup is incomplete. It's a particular kind of frustration when you're being told that your infertility is unexplained. Because unexplained doesn't mean there's no reason. It just means that the people looking haven't looked far enough. And for a lot of the women that I see in my practice, the reason has been sitting in their gut the entire time. My name's Ina. I'm a naturopathic doctor focused on fertility. And SIBO, small intestinal bacterial overgrowth, is one of the most common things that I find when I dig deeper into a patient's case. And unfortunately, it is almost never tested for. Having it can disrupt your body's ability to conceive. This is the protocol that I use with my patients in order to overcome SIBO and help them get pregnant. SIBO is a bacterial overgrowth in your small intestine. Although your gut has lots of good bacteria, too much bacteria in the wrong place can cause more than just an upset stomach. SIBO crowds the intestinal wall and blocks the absorption of the necessary nutrients for conception. Testing for SIBO is not invasive. You can do it at home or in clinic, and it measures the gas that the bacteria produce. It's usually a test that you will have to specifically request. Once you know you have SIBO, my treatment plan has 4 phases. In phase 1, we have to clear the overgrowth. Either rifaximin, a targeted antibiotic that works specifically in the small intestine, or herbal antimicrobials like berberine, oregano, and allicin. Herbal is slower but gentler. In phase 2, we will repair the gut lining. The overgrowth damages your intestinal lining, so absorption stays low even after the bacteria are cleared. Glutamine, zinc, carnosine, collagen, and aloe vera are the main supports here. This phase is non-negotiable. In phase 3, it's important to rebuild your microbiome. The probiotic strains we will choose matter. Some of the ones I usually target for repopulating your gut microbiome are Lactobacillus reuteri, Lactobacillus plantarum, and Bifidobacterium longum. It is important to work on the reintroduction slowly to make sure that your symptoms are not intensified. In the final phase, we will replenish what you lost. We will test and retest your B12, iron, zinc, vitamin D, and vitamin A. After months or years of poor absorption, these are likely low, and supplementing now that you can actually absorb is a completely different experience. This is where egg quality starts to genuinely recover. Most people with SIBO get labeled with unexplained infertility and are told to just keep trying. But the problem was never their fertility. It was that their body couldn't absorb nutrients, couldn't clear hormones, and couldn't stay out of inflammation long enough to grow a baby. If you fix the gut, everything else gets easier. Save this video because the full protocol is here and you'll want it. And if this is the first time that anyone has ever connected your gut to your fertility, tell me in the comments.